Hello everybody and welcome back to my channel. Today I will be talking about a sign that is called ptosis, which you may call a droopy eyelid. Now there are several causes for why one may have a droopy eyelid or a ptotic eyelid, and a droopy eyelid is simply a sign. Today I will talk about what conditions can be underlyingly causing a droopy eyelid, so please stay tuned. There are very many conditions that can cause a droopy eyelid, and the most common cause for this is age-related droopy eyelid or ptotic eyelid, and there can also be more serious, potentially life-threatening conditions that could be causing the appearance of a droopy eyelid. So we will talk about the various different conditions in turn. It is also important to remember that there are also some congenital causes for why one may have a droopy eyelid, but the focus of this video will not be centered upon those. By far and away, the most common cause of a droopy eyelid is a droopy eyelid that comes on with age. This basically occurs due to age-related wear and tear changes in the muscles and tendons that help to keep our eye in a normal anatomical position. Surgery, trauma, and contact lens use can also contribute to this droopiness. The two big serious conditions that can cause a ptosis include a third nerve palsy and also a Horner's syndrome. Both of these, as I said, can be life-threatening, and therefore they need to be diagnosed and treated promptly. In terms of a third nerve palsy, there will also be the presence of other signs, such as the eye being in an abnormal position. Usually the eye is down and out, and the patient may also describe double vision if the lid has not drooped enough to cover the actual visual axis. In terms of Horner syndrome, patients will have a small pupil, they'll have a droopy eyelid, and they can also have reduced sweating on one side of their face. Importantly, a third nerve palsy that also has a droopy eyelid will have a dilated pupil as opposed to a small pupil that occurs with a Horner syndrome. Another cause of a droopy eyelid is Myasthenia Gravis. You can watch my video about Myasthenia Gravis to learn more about that, but essentially it is a condition where you get fatiguing of muscles, and therefore patients can present with a droopy eyelid that changes from day to day, and it can also change on an individual day itself. The other cause of a droopy eyelid that one should be aware of is mechanical causes. So if somebody has an actual lid lump in and around the eye, then it goes without saying that that could cause the lid to droop downwards. There could also be some conditions that are referred to as pseudo-ptotic conditions, meaning that the lid is actually in a normal position. It just appears as though it is lower than it should be. And this can happen, for example, if one's eyebrows are lower than they should be, or if one has excessive skin in the upper part of the eyelid, which causes the eyelids to sag downwards. The important points when faced with a patient with ptosis or a droopy eyelid include: firstly, inquire about whether it is something that has come on as a new finding or feature, or if it's something that has always been present. So old photographs and accounts of family members and friends can be helpful in trying to decipher and determine this. The other thing to understand and ascertain is, does it change throughout the day or from day to day, which could point to a Myasthenia Gravis type picture. Also, look out for worrying features and symptoms, such as the ones that can present in addition to or associated with a third nerve palsy or a Horner syndrome. So in Horner syndrome, has there been a trauma? Is the patient describing neck pain? Is the patient describing difficulty in focusing with their vision? In terms of a third nerve palsy, is the patient describing double vision? Is their eye in an obviously abnormal position with both Horner syndrome and a third nerve palsy? Do they have an associated headache? Or is it something that has gradually occurred over time, and does it fit with the patient's age? So these are important clues that can be ascertained simply through asking the patient questions, and then when you perform a comprehensive examination to look at the pupils, to check the vision, to check the eye movements, to measure the amount of ptosis, to check the function of the muscle within the eyelid itself, and also to check the position of the lid creases. That will also help you to understand what is the underlying etiology of the droopy eyelid. I hope you've liked this video. If you have done so, then please do click the like button, click the subscribe button, click the bell icon, and please do comment. Thank you very much for your support. I'll see you next time. Take care.